Question 1. A pregnant client at 32 weeks reports sudden painless vaginal bleeding. What is the priority action? A. Vaginal exam. B. Assess fetal heart rate. C. Check temperature. D. Encourage walking. Correct answer, B. Assess fetal heart rate. Rationale: painless bleeding suggests placenta previa, fetal status is priority. Strategy: bleeding in pregnancy equals check baby first. Question 2. A postpartum client has a boggy uterus. What should the nurse do first? A. Call doctor. B. Massage fundus. C. Give fluids. D. Check BP. Correct answer, B. Massage fundus. Rationale: boggy uterus indicates uterine atony causing hemorrhage. Strategy: boggy uterus equals massage first. Question 3. Which sign indicates magnesium sulfate toxicity? A. Hyperactive reflexes. B. Absent reflexes. C. Tachycardia. D. Hypertension. Correct answer, B. Absent reflexes. Rationale: loss of reflexes is early sign of toxicity. Strategy: magnesium sulfate equals check reflexes. Question 4. A newborn has acrocyanosis. What is the nurse's action? A. Call physician. B. Normal finding. C. Give oxygen. D. Warm baby immediately. Correct answer, B. Normal finding. Rationale: acrocyanosis is common in newborns. Strategy: hands and feet blue equals normal. Question 5. A client in labor has variable decelerations. What is the first action? A. Increase 4 fluids. B. Reposition mother. C. Give oxygen. D. Call provider. Correct answer, B. Reposition mother. Rationale: variable decelerations indicate cord compression. Strategy: decelerations equals reposition first. Question 6. Which position prevents supine hypotension? A. Supine. B. Left lateral. C. Sitting. D. Prone. Correct answer, B. Left lateral. Rationale: improves blood flow to placenta. Strategy: pregnancy hypotension equals left side. Question 7. A client reports severe headache and blurred vision. This indicates A. Anemia. B. Preeclampsia. C. Dehydration. D. Infection. Correct answer, B. Preeclampsia. Rationale: classic signs of preeclampsia. Strategy: headache plus vision equals preeclampsia. Question 8. What is the priority for newborn immediately after birth? A. Bath. B. Warmth. C. Feeding. D. Measurements. Correct answer, B. Warmth. Rationale: prevents heat loss. Strategy: newborn equals warm first. Question 9. A client has rupture of membranes. What should be assessed first? A. Maternal BP. B. Fetal heart rate. C. Temperature. D. Pain level. Correct answer, B. Fetal heart rate. Rationale: risk of cord prolapse. Strategy: ROM equals check FHR. Question 10. Which finding indicates true labor? A. Irregular contractions. B. Cervical dilation. C. Pain relieved by rest. D. No back pain. Correct answer, B. Cervical dilation. Rationale: true labor causes dilation. Strategy: true labor equals dilation. Question 11. A newborn HR is 90 BPM. What is the priority? A. Stimulate newborn. B. Feed baby. C. Swaddle baby. D. Call parent. Correct answer, A. Stimulate newborn. Rationale: HR below 100 requires stimulation. Strategy: newborn HR less than 100 equals stimulate. Question 12. A pregnant client reports decreased fetal movement. Priority: A. Encourage fluids. B. Assess fetal heart rate. C. Rest. D. Call family. Correct answer, B. Assess fetal heart rate. Rationale, indicates possible fetal distress. Strategy, less movement equals check FHR. Question 13. Which indicates placental separation? A. Cord lengthening. B. Contraction stop. C. Pain. D. Fetal movement. Correct answer, A. Cord lengthening. Rationale, sign placenta detached. Strategy. Cord lengthening equals placenta delivered. Question 14. A newborn temperature is 35 degrees Celsius. What is the priority? A. Feed. B. Warm baby. C. Call doctor. D. Bath. Correct answer, B. Warm baby. Rationale, hypothermia risk. Strategy, low temp equals warm. Question 15. Which indicates postpartum hemorrhage? A. Firm uterus. B. Heavy bleeding. C. Mild cramping. D. Light lochia. Correct answer, B. Heavy bleeding. Rationale, excessive bleeding equals hemorrhage. Strategy, heavy bleeding equals emergency. Question 16. A client with preeclampsia should be placed in A. Left lateral. B. Supine. C. Sitting. D. Prone. Correct answer, A. Left lateral. Rationale, improves perfusion. Strategy, preeclampsia equals left side. Question 17. First sign of labor. A. Regular contractions. B. Cervical change. C. Pain. D. Backache. Correct answer, B. Cervical change. Rationale, true labor equals cervical change. Strategy, cervix tells labor. Question 18. Which indicates newborn distress? A. HR 130. B. HR 80. C. RR 40. D. Pink skin. Correct answer, B. HR 80. Rationale, low HR. Strategy, HR less than 100 equals distress. Question 19. Which indicates infection postpartum? A. Fever. B. Hunger. C. Sleep. D. Mild pain. Correct answer, A. Fever. Rationale, fever equals infection. Strategy, fever postpartum equals concern. Question 20. Best breastfeeding position. A. Cradle. B. Upright. C. Supine. D. Standing. Correct answer, A. Cradle. Rationale, comfortable feeding. Strategy, cradle common. Question 21. Cord prolapse priority? A. Knee chest position. B. Ambulate. C. Sit. D. Feed. Correct answer, A. Knee chest position. Rationale, relieves cord pressure. Strategy, cord prolapse equals knee chest. Question 22. A pregnant client at 38 weeks reports sudden gush of clear fluid. What is the nurse's first action? A. Check blood pressure. B. Assess fetal heart rate. C. Perform vaginal exam. D. Encourage ambulation. Correct answer, B. Assess fetal heart rate. Rationale. Rupture of membranes increases risk of cord prolapse affecting fetal oxygenation. Strategy, ROM equals always check baby first. Question 23. Which finding requires immediate intervention during labor? A. Fetal heart rate 140 bpm. B. Contractions every 5 minutes. C. Late decelerations. D. Cervix 5 cm. Correct answer, C. Late decelerations. Rationale, late decelerations indicate uteroplacental insufficiency. Strategy, late decelerations equals danger. Question 24. A postpartum client saturates one pad in 15 minutes. What is the priority? A. Check temperature. B. Massage fundus. C. Encourage fluids. D. Assess pain. Correct answer, B. Massage fundus. Rationale, excessive bleeding suggests uterine atony. Strategy, heavy bleeding equals massage fundus first. Question 25. A newborn has a respiratory rate of 65 breaths per minute. What is the nurse's action? A. Normal finding. B. Assess further. C. Feed newborn. D. Swaddle baby. Correct answer, B. Assess further. Rationale, normal newborn RR is 30 to 60, 65 is tachypnea. Strategy, out of normal range equals assess. Question 26. Which sign indicates preterm labor? A. Contractions at 36 weeks. B. Back pain at 20 weeks. C. Contractions at 28 weeks. D. Mild nausea. Correct answer, C. Contractions at 28 weeks. Rationale, labor before 37 weeks is preterm. Strategy, less than 37 weeks plus contractions equals preterm labor. Question 27. Which medication is given to mature fetal lungs? A. Oxytocin. B. Betamethasone. C. Magnesium sulfate. D. Pitocin. Correct answer, B. Betamethasone. Rationale, steroids improve fetal lung maturity. Strategy, preterm baby equals give steroids. Question 28. A newborn is cyanotic and not breathing. What is the first action? A. Start chest compressions. B. Stimulate newborn. C. Call physician. D. Give feeding. Correct answer, B. Stimulate newborn. Rationale, initial resuscitation begins with stimulation. Strategy, ABC stimulate first. Question 29. Which finding indicates placental abruption? A. Painless bleeding. B. Severe abdominal pain. C. No contractions. D. Clear fluid. Correct answer, B. Severe abdominal pain. Rationale, placental abruption causes painful bleeding. Strategy, painful bleeding equals abruption. Question 30. A client in labor becomes hypotensive after epidural. What is the priority? A. Increase 4 fluids. B. Sit patient upright. C. Check temperature. D. Give medication. Correct answer, A. Increase 4 fluids. Rationale. Epidural can cause hypotension. Strategy, epidural hypotension fluids. Question 31. Which finding is expected in pregnancy? A. Decreased blood volume. B. Increased heart rate. C. Decreased cardiac output. D. Decreased urine output. Correct answer, B. Increased heart rate. Rationale, pregnancy increases cardiac demand. Strategy, pregnancy equals increased circulation. Question 32. A newborn blood glucose is 35 mg per deciliter. What is the priority? A. Feed newborn. B. Call doctor. C. Swaddle baby. D. Check temperature. Correct answer, A. Feed newborn. Rationale. Hypoglycemia treated with feeding. Strategy, low glucose equals feed. Question 33. Which indicates postpartum infection? A. Temperature 38.5 degrees Celsius. B. Mild cramping. C. Lochia rubra. D. Fatigue. Correct answer, A. Temperature 38.5 degrees Celsius. Rationale, fever indicates infection. Strategy, fever postpartum equals infection. Question 34. A pregnant client reports blurred vision. What is the priority? A. Check BP. B. Give fluids. C. Encourage rest. D. Check temperature. Correct answer, A. Check BP. Rationale. Blurred vision suggests preeclampsia. Strategy, vision changes equals check BP. Question 35. Which position improves fetal oxygenation? A. Supine. B. Left lateral. C. Sitting. D. Prone. Correct answer, B. Left lateral. Rationale, improves uteroplacental perfusion. Strategy, pregnancy equals left side. Question 36. A newborn has meconium-stained fluid. What is priority? A. Suction airway. B. Feed baby. C. Weigh newborn. D. Bathe baby. Correct answer, A. Suction airway. Rationale, prevent aspiration. Strategy, meconium equals suction. Question 37. A postpartum uterus is deviated to the right. What should nurse do? A. Massage uterus. B. Assist to void. C. Call physician. D. Give medication. Correct answer, B. Assist to void. Rationale, full bladder displaces uterus. Strategy, deviated uterus equals empty bladder. Question 38. Which indicates fetal distress? A. Moderate variability. B. Tachycardia. C. Accelerations. D. Fetal movement. Correct answer, B. Tachycardia. Rationale. Fetal tachycardia suggests distress. Strategy, abnormal FHR equals distress. Question 39. Which finding is normal postpartum? A. Firm uterus. B. Heavy bleeding. C. Fever. D. Foul lochia. Correct answer, A. Firm uterus. Rationale, firm uterus prevents hemorrhage. Strategy, firm equals good. Question 40. Which vitamin is essential in pregnancy? A. Vitamin C. B. Folic acid. C. Vitamin K. D. Vitamin A. Correct answer, B. Folic acid. Rationale, prevents neural tube defects. Strategy, pregnancy equals folic acid. Question 41. A newborn APGAR score of 4 indicates A. Normal. B. Moderate distress. C. Severe distress. D. Healthy. Correct answer, C. Severe distress. Rationale, low APGAR indicates poor adaptation. Strategy, low APGAR equals emergency. Question 42. Which indicates magnesium toxicity? A. Increased reflexes. B. Respiratory depression. C. Hypertension. D. Tachycardia. Correct answer, B. Respiratory depression. Rationale, magnesium depresses respiration. Strategy, magnesium equals monitor breathing. Question 43. Which is first stage of labor? A. Delivery of baby. B. Cervical dilation. C. Delivery placenta. D. Recovery. Correct answer, B. Cervical dilation. Rationale, first stage equals dilation. Strategy, stage 1 equals dilation. Question 44. A newborn temperature is low. What is the priority? A. Warm baby. B. Feed. C. Weigh. D. Bath. Correct answer, A. Warm baby. Rationale, prevent cold stress. Strategy, cold baby equals warm. Question 45. Which indicates cord prolapse? A. Fetal tachycardia. B. Cord visible. C. Bleeding. D. Contractions. Correct answer, B. Cord visible. Rationale, cord in vagina indicates prolapse. Strategy, cord visible equals emergency. Question 46. A pregnant client has edema and hypertension. What condition? A. Gestational diabetes. B. Preeclampsia. C. Infection. D. Anemia. Correct answer, B. Preeclampsia. Rationale, classic signs. Strategy, BP plus edema equals preeclampsia. Question 47. Which finding indicates newborn hypoglycemia? A. Jitteriness. B. Sleeping. C. Crying. D. Warm skin. Correct answer, A. Jitteriness. Rationale, low glucose causes jitteriness. Strategy, jittery baby equals check glucose. Question 48. Which hormone causes labor contractions? A. Estrogen. B. Oxytocin. C. Progesterone. D. Prolactin. Correct answer, B. Oxytocin. Rationale, stimulates contractions. Strategy, oxytocin equals contractions. Question 49. Which newborn finding requires intervention? A. Acrocyanosis. B. Apnea. C. Crying. D. Sneezing. Correct answer, B. Apnea. Rationale, apnea is abnormal. Strategy, no breathing equals emergency. Question 50. Priority after placenta delivery? A. Assess fundus. B. Feed newborn. C. Clean room. D. Weigh baby. Correct answer, A. Assess fundus. Rationale, prevent postpartum hemorrhage. Strategy, after placenta equals check uterus.